new actions to stop the spread of the coronavirus.
We will be suspending all travel from Europe to the United States for the next 30 days.
Communities shut down. Major sporting events and concerts canceled as the numbers of cases and deaths in the U.S. continue to rise.
The death rate depends on who you are and where you are.
Yeah, obviously I'm taking it more seriously now that I have it.
Tonight, it's just the facts, no politics. We're talking with Dr. Anthony Fauci, who's on the president's coronavirus task force and is one of the nation's leading researchers. U.S. Surgeon General Vice Admiral Jerome Adams shares his knowledge on keeping your loved ones safe. We've also gathered a team of doctors, medical experts to help dispel the myths from the reality and what you might not be thinking of when it comes to your pets.
You know, we are a country that has farm animals and people that work with animals every day that aren't just your dog or cat in the household.
This is an America This Week special, Coronavirus. Plan, don't panic. There's an overload of information out there right now about the new coronavirus or COVID-19, the numbers, the symptoms, how to keep it from spreading. Thanks for joining me for this special America This Week Coronavirus Plan, Don't Panic. For the next hour, we'll bring you the crucial facts from the federal government and some of the top doctors in the nation. The goal to better prepare you for what to expect in the days, weeks, and months ahead. This week, the president made some significant announcements regarding his administration's response to the coronavirus. Take a listen.
After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings. These restrictions will also not apply to the United Kingdom. At the same time, we are monitoring the situation in China and South Korea, and as their situation improves, we will reevaluate the restrictions and warnings that are currently in place for a possible early opening. Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time.
Dr. Anthony Fauci is on the president's coronavirus task force and has been the face of the administration's response to the coronavirus. Dr. Fauci, thank you for being here with us. So much to get to, and you are the man, the immunologist on the forefront of this deadly disease. Sir, let me start in China, if we may. We believe that to be the origin of COVID-19. Do we trust what the Chinese are telling us about the numbers and what went on there?
Yeah, I think right now we do. In the beginning, when the first cases were recognized towards the end of December of 2019, they were giving the impression that there wasn't really any human-to-human transmissibility. There was just animal-to-human. Well, there's no doubt that originally, when it started, it was one of those situations where it jumped from an animal reservoir to a human. But they were having human-to-human transmissibility for at least a few weeks before they finally let people know. And that was to their detriment, but then ultimately to the detriment of the rest of the world, because instead of identifying and warning their population to be able to essentially not go to crowded places because there's a respiratory illness going around, they acted like there was no danger. And there were things like, 40,000 person street parties in celebration of the coming new year and things like that really made it very, very difficult to do any containment. And by that time, the horse was out of the barn. But today, where we are right now, we really believe that the numbers and the information that's coming out of China is actually correct. And in that regard, we also, as part of the WHO team that went there, we in the United States had 2 representatives who did that, one from the NIH, my institute, and one from the CDC. Bottom line is that today we do feel the information is correct.
So, Dr. Fauci, I hear that and I understand that, and I hope you're right. My concern is, and this is something that's been talked about, is this, in fact, what you mentioned, an animal-to-human transmission? Did it jump from animal to human? The concern is, and it's a valid one, if people are worried about it, it's a valid one, is that Wuhan province in China is one of the areas that they produce biological weaponry for the Chinese army, military. Is it possible? Is it possible that this may be a leak from that laboratory by accident, right? By accident, but maybe the cause of this?
Well, when you're dealing biologically, anything is possible. Let me tell you why that's extraordinarily unlikely. First of all, we know that these viruses jump species. We had SARS in 2002, which went from a bat to a civet cat, which is an animal that's eaten and sacrificed at festivities, festival dinners in China. That was in 2002. In 2012, we had MERS, the Middle East Respiratory Syndrome, which was essentially going again from a bat, this time to a camel, and then in Saudi Arabia it broke out. If you look at the evolution of the viruses in bats, you can see that the mutations that occurred gradually over time in the wild, not necessarily in a lab, really were getting closer and closer and closer to being able to adapt itself with probably an intermediate host. We don't know what that host is yet. There have been some surmises about what it is. So that if you track its normal evolution, there's more than every reason to believe that this just was a natural occurrence, much, 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 much more likely of jumping from an animal in the wild, particularly with the exposure.
I'm sorry to cut you off. I'm trying to figure, okay, let's assume all that is true. Why did Italy become such a hot spot? Why is the whole nation, the whole country on lockdown right now? What happened there?
What happened is that they did not, as we did, restrict travel from China. And the Chinese travel all over the world. There's 1.4 billion of them, and they travel all over to the United States and to Italy and to the European Union. And one of the issues which is unfortunate for the European Union, particularly for Italy, because they're suffering the most, is that there were no constraints on travel. You might recall that we in the United States, under President Trump's order, essentially shut down travel, making it very, very difficult. Certainly not from people who are Americans who want to come back. They still have to go under a 14-day self-imposed quarantine. But we did that early, and so therefore the influx from China was markedly diminished. The Italians, unfortunately, did not. So the origin of theirs originally was from China, and now what's happened, unfortunately, is that the bulk of the transmission to other countries, including our own, is coming actually from Europe. And that's the reason why last night the president made the announcement that we're going to do the same sort of travel restriction for that group of countries in the European Union that we did for China. Again, to keep out the influx of cases.
Allow me to bring it domestic, bring home, so to speak. How many people in America, in the United States, do you think will end up being, and I know this is, you're going to tell me I don't know, there's no way of knowing. Give me your best guess. You're the premier immunologist in America. How many people do you think, there's a number bantered around recently on Capitol Hill that maybe 100 million Americans may be infected. What are your thoughts?
Yeah, I think that the number 100 million is probably a bit off the chart. When people make estimates, they do it by models, and the model is only good as the assumption that you put into the model. And what they would do is they say, well, let's say 5% of the population is infected, let's say 10%, let's say 20%, and et cetera, et cetera. If you then model in what is the infection rate, how many people who, when when one person is infected, how many people do they infect? And they put all kinds of assumptions into the model, and they have a range. And whenever you have a model, you have a low level and the absolute high level. And whenever people report the model, the press only reports the high level. So, I mean, you can't predict. No one will go on record predicting how many cases we're going to have. But when you're talking about 100 million, that's, I believe, way, way out there.
Fair enough.
And likely much more like a pandemic that we had in 1957.
Which infected how many?
Well, see, let's take a look at what we have right now. When you look at the amount of individuals who are infected on any given year, it ranges from around 15, 20,000 up to the worst year that we recorded was in 2017-18. That was about 79,000.
Deaths, not infected, but deaths.
Into a couple of hundred. Yeah. Well, no, I'm talking infected now. Now, be careful that we don't confuse deaths with infections. If you're talking about infections, you're talking about in the pandemic year, 100,000, 150,000. If you're talking in a seasonal year, it goes anywhere from 15,000 to about 79,000. The death rate right now, if you look at what's going on in the rest of the world, what we call the case fatality rate is about 3%. That means that 3% of the people will wind up dying. However, it's much, much, much more skewed towards the elderly and those with underlying conditions. So if you look at the death rate of younger people, children, adolescents, young adults, it's very low. It's very low. It's a fraction of a percent. If you go to the elderly, it goes way up, particularly those who get in serious condition. It could be 15, 20, 25, or even more.
Doctor, a lot of those numbers, the how many infected, how many will die, will be dependent upon the vaccine timetable. Give the American people right here, you're talking to Republicans, Democrats, and independents, you're talking to people into their living room in America via broadcast television right now. How long before a vaccine do you believe will be available to us to put a top on this?
Well, there's two questions you just threw at me. The first, you made an assumption that I would respectfully disagree with. You said how many people are going to wind up getting infected and wind up ultimately dying is depending on a vaccine. That's really not the case because there are public health measures, which we call containment and mitigation, that have nothing to do with a vaccine, that actually can have a major impact on diminishing both the infection rate, the morbidity, and the mortality. So we have to be careful. In the future, and I've said this many times, even though we've entered into vaccine trials, or will in the next few weeks, at a faster time frame than anybody has ever done it literally in the history of developing vaccines, still it's a multi-step process. We've gone very quickly on the first step, which is a phase 1 trial. Then you take it for a few months to see if it's safe. Then you go into a much larger trial to see if it works. That process takes at least a year to a year and a half. So for the challenge that we are facing now and will face in the next few weeks is going to have nothing to do with vaccines. Vaccines are not going to be ready until a year to a year and a half. So right now, it's all containment and mitigation.
Speaking of containment and mitigation, it strikes me as an outside viewer here that these cruise ships aren't necessarily the reason for it, but they certainly are an incubation for some of these viruses, norovirus and now coronavirus. If they won't, shut down their own business voluntarily, is there a thought that maybe it's something like restricting travel on cruise ships, at least until we get a handle on this with the administration?
Well, there's one thing that's going on right now is a very, very strong recommendation that anyone who's elderly and or has an underlying condition, even if you're not elderly, you should not travel on cruise ships, period. Now, right now, the president has met with either the president or the vice president, I'm not sure, has met with the CEOs of the cruise ships to try and get them to absolutely uptick and upgrade their infection control capabilities, their screening capabilities, to make it less likely that they would get somebody on board who's infected, and if so, they'll know how to handle it.
Sir, I was with the vice president when that was going on. The president was meeting with the cruise ship CEOs. I was with the vice president, sitting next to him in a briefing, in an information session, and they did not, the cruise ship CEOs did not decide to shut themselves down. I mean, you're putting people, thousands of people in close quarters. The NBA has decided to delay their season. Anything with 2,000 or 3,000 people have been eliminated. No spectator sports. I mean, this is, shouldn't the cruise ships be forced or told, no mas, let's take some time off, they're here?
Well, I think they should very seriously consider that as a single person, one person in the task force. I don't want to get ahead of the task force, but you make a very good point. If you're trying to get rid of the situation where you have a lot of crowds, definitely cruise ships should be considered in that category. And I've been saying that all along. I was asked publicly about that, and I wouldn't recommend going on a cruise ship.
Right. Doctor, before we let you go, you're a busy man, and we're thankful for the time with you. Before we go, another thing that came out of that briefing with the vice president was masks. Now, at first we were told, I believe you had said, that the masks don't work generally to prohibit yourself, prophylactically prohibit yourself from getting the coronavirus. However, we have doctors, and we have doctors on the show later, who said they can't see patients because they don't have enough protective gear to see patients. Do the masks work? And if they do, when will we have enough masks?
Okay, so let me clarify. I never ever said masks don't work. What I said was that people who are now out in the street, walking around Washington, D.C., wherever, do not need to wear masks. They should not be wearing masks for several reasons. First of all, the masks are needed by both people who are in the hospital and infected to protect them from, not to protect them, but to prevent them from infecting others. But more importantly, the healthcare providers who put themselves at risk into coming into contact with people who are infected. There would not be enough masks if everybody in the population decided they wanted to wear masks. With regard to how effective they are, it depends on the mask. A regular surgical mask can keep out droplets. However, for pure virus, it's not completely protective, so you don't want people walking on the outside who shouldn't be wearing masks anyway, thinking they're thoroughly protected. If you're a healthcare worker, you're at a much greater risk. That's the person that should be wearing the mask. So it's not a question of is it effective or not, it's who should be wearing them.
Noted, duly noted. Thank you again for your time, Dr. Anthony Fauci. Really appreciate your time. U.S. Surgeon General Vice Admiral Jerome Adams is with me to discuss the latest on the coronavirus, or COVID-19. Thank you for being here, General. Good to see you again. Full disclosure, you and I have worked together on other projects. We've known each other for quite a while.
Absolutely. Good to be here.
General, I listen to the media. I watch a lot of the hype going on. Can you give us a sense of how much of what we're hearing on TV is real and how much is, I won't say fear-mongering, panic. Let's call it that.
Well, there's a lot of misinformation out there, and I appreciate the opportunity to clear some of it up. It's important for folks to know that the novel coronavirus originated in China, but it's really from a family of viruses that include everything from the common cold to MERS and SARS. And we've successfully dealt with these in the past. We will successfully deal with this if we can help people understand the facts and not overreact.
So I want to stay on that a little bit. So, and there are a lot of things I want to get to, so bear with us. There's a lot of interest in this topic. It originated in China.
Yes.
A lot of people are saying it may have been a biological weapon that potentially may have leaked out of Wuhan. We know Wuhan, the province in China, is where the Chinese developed some of their weaponry. Is it unreasonable to think that this possibly could be a man-made disaster accident?
Well, what I would say is I've talked to Tony Fauci, I've talked to Robert Redfield, I've talked to the top virologists in the world, and everyone believes that this is following the same pattern as MERS, as SARS, as other viruses that have gone from animals to humans, and that there is absolutely no proof out there, no evidence, nothing to suggest that there was anything nefarious going on here. This is just what happens sometimes, and we've seen it happen before.
All right, let's talk about some things that are going on in in America right now. The quarantining. New Rochelle, New York has now decided to put a perimeter around their city. Seemed extreme. Is it smart or overreacting on their part?
Well, it's important for people to know that we are shifting from a containment to a mitigation posture right now in this country. Containment means we know where the cases are coming from. We want to keep them out. And it's why the administration had really strong travel restrictions back and forth to China, because we knew the majority of the cases were coming from there. Well, now the majority of cases are coming from Europe, from Italy, from Japan, from South Korea, and from all over the world. And we can no longer expect to hermetically seal the United States. So we're shifting to a posture of making sure communities know how to deal with cases when they do find them. And so that's why you see places that are affected like Seattle, like California, and like New York, talking about closing schools, talking about pulling down.
Are these good ideas, sir?
These are actually tried and true public health ideas, but again, we need to apply them strategically. We don't need to do them everywhere, but everywhere needs to have a plan for really tamping down cases if you do see community
So let's stay on that. Closing schools, I get it, or we're talking about possible sporting events not having spectators. I even understand that. You don't want a lot of close contact, people yelling, it could spread a virus. I get that. But when a town or a municipality puts a ring around themselves, a border around themselves, have they gone too far?
Well, one of the things I would point out is the response in China. And China went from having by far over 95% of the cases in the world, the majority of cases, to now having just a few cases, double digits each and every day. And they did it with aggressive posturing.
Can I interrupt you?
Yes.
Do you believe what's coming out of China, the numbers?
Well, we believe what's coming out of China now. We knew that we had trouble getting information at first. Secretary Azar, the president, the vice president have worked very well with them, and we feel much better about the numbers there. One thing that I will say is that I do believe their cases have come down dramatically.
Final question before we let you go. These things are in major demand. They're sold out on every shelf, every Walmart, every Target. Amazon sold out of these. They're everywhere. The hand sanitizers, you can't get them. You can't get gloves. You can't get rubbing alcohol because people realize you can make hand sanitizer with rubbing alcohol and aloe vera gel. All these things are sold out. I guess as companies come up to speed, we'll get that back. Are they effective?
Well, what's more effective is good old-fashioned soap and water. And that's why I tell people, make sure you wash your hands for 20 seconds, soap and water. Yes, having hand sanitizer is a good plan B, but just go in the bathroom and wash your hands. The most effective thing we can do to prevent coronavirus. And really quickly, I would tell people, know your risk. If you have chronic medical illnesses and you're older, then you definitely should be taking precautions. Know your circumstances. Don't go into a crowded situation if you're at risk. And then go to coronavirus.gov for tips on how you can stay safe.
One more quick question, Doctor, there's so much going on. You know, the elderly, the nursing homes, we've been told by the administration and others and doctors to stay away from them. That's concerning. That scares people. I think that's part of the fear and the panic, to think that you can't see a loved one because you may bring them corona or they may give it to you, a virus that could kill you.
Also because it's a bad flu season. You could bring them flu.
That's a great point. That's a great point. It's probably not advisable to do it during a regular flu season, not just a coronavirus outbreak.
Exactly. And we're really leaning into working with the nursing home industry to make sure healthcare practices, infection control practices are top-notch. We've sent in thousands of CMS officers to help boost inspection in nursing homes. We want to make sure we're protecting our most vulnerable.
Surgeon General, Dr. Jerome Adams, thank you very much for joining me, and good to have you, sir.
Good to have you.
Corona elbow.
Absolutely.
Good to see you, sir. Thank you. Let's go now to Dr. Todd Goldman, an emergency medicine doctor based in Boulder, Colorado. Doctor, thank you for coming on the show. Well, you are the man. I've been in your emergency room. You run that thing like a tight ship. Tell us what you're looking for with coronavirus, COVID-19. What are the protocols you're looking to use, employ, and what are your concerns?
Hi, Eric. Yes. COVID-19, in terms of our response from a community and from an emergency department, really starts out in the EMS world. Those are the emergency medical services people. So this starts when someone calls into one of our dispatch centers. You know, that would be a 911 type call. I'm having a respiratory problem, a fever, chills, whatever it is. We've put in place specific screening testing protocols at the dispatch level for the entire city and county of Boulder, and we're following all of the Metro Denver and Colorado State guidelines also. And that's all being dictated down from our experts nationally.
Well, Doc, give us a sense. We got it. I got that, but what does that mean? So our EMS workers going to go out with masks on, glasses on, gloves?
Yes.
Tell us.
Yes. So right now, originally we thought that we needed to use some specific types of masks called N95 masks, goggles, and full gown and glove protection. This disease is actually spread by droplets, okay? It is not like measles where you breathe on someone and you get it. So we are actually at this point, due to limited personal protective equipment, we are sending people out with normal surgical masks, gowns, gloves, and goggles when anyone screens positive for a potential COVID-19 case. So we are taking specific precautions in the field. We're only sending one emergency service provider in, and we are sending only the full team in if there's a life or limb threatening situation. And then, Eric, we need to decide on transport. In other words, we can't overwhelm our healthcare system on the other end with a bunch of people who don't require urgent or emergent care. So we're making, based on the state of emergency in Colorado, the medical directors are allowed to make some exceptions and leave people at home who should not be overwhelming our system. And so, this is all about protecting a surge.
Right. In surge, and that is with the panic and with so many unknowns, people may try and call 911 because they have, I don't know, trouble breathing, it may be nothing other than maybe a little COPD or something, whatever. My point is now, you've got this EMS worker who brings a patient in, they present with, what are you looking for? What is Dr. Dorfman looking for when they see someone to specifically look for COVID-19?
Well, that's an incredibly difficult question because, as you know, the spread is significant and there may or may not have been known exposures. So originally, this was easy. There wasn't very much in the United States, and part of our screening questions were, have you traveled to, Italy, South Korea, Iran, China, and or have you been exposed to a COVID-19 positive patient in that sense? So anyone who hit positive on that screening was put through a special protocol and specific testing. Now, unfortunately, it's in the state of Colorado, as it is everywhere. There's probably way more cases than we even know about. So we are literally treating everyone like they have a COVID infectious disease.
And how is that different? How does that differ from someone with a severe influenza virus?
It doesn't, to be honest with you. And we probably should be always doing this, and we should probably be diligent about this every time there's a flu season. If you look statistically across the globe, this really is very similar to influenza without an influenza vaccine. In other words, let's say half the population gets the influenza vaccine and that vaccine is 50%, effective or so. That's about 25% of the population, roughly, that is protected to some extent against influenza. The problem with this novel or new coronavirus is we really don't have a vaccine, so it's really new to the general public, and that's the issue really, is so many people could potentially get the disease. Even if the morbidity and mortality rates are similar to influenza, this just might be a bulk of people that get the disease. It just might be a bigger number.
Dr. Todd Dorfman, we say thank you very much. We'd like to keep you on the list because it looks like this is going to be around for a while. We'll bring you back, Todd. Thank you very much for your time.
Thank you so much for having me.
And ahead on America This Week, our panel of medical experts discusses the alarming issues doctors are facing and experiencing while trying to treat patients. And now I'd like to introduce our panel of expert physicians to discuss the virus. Dr. Dina Grayson is an expert on pandemic threats. Dr. Colby Grossman, president and founder of the Palmetto Clinical Research, and Dr. Mark Bruce, an emergency medicine physician. I'm going to start with you, Dr. Colby. You're wearing the lab coat. And you and I had a discussion. Full disclosure, you're my doctor. You and I had a discussion, and you said you're concerned about the availability of protective gear for doctors. Tell us what's going on.
Yeah, thanks, Eric. I want to thank you for just hearing my plight and getting me to this amazing panel. So what I hope and pray is that discussions like this will ultimately lead to more efficient ways that we can test our patients. So I have plenty of this, okay? This is a test swab for a nasal swab. What I don't have is plenty of this. This is an N95 mask, and I only have 5 of these in my office, and I can't get any at all. I found one on eBay today for $175. And these guys, the CDC, says I have to have this every time I go into a room. So I can't test if I can't be protected. That's my plight.
I'm going to bring this over to Dr. Bruce. You hear Dr. Colby saying he can't get the protective masks. I mean, let me guess, I think your specialty, they told me, was emergency room medicine.
Right.
Now, tell us about that. That's got to be even scarier.
Yeah, I mean, for years, we've had stacks of masks outside of all the patient care rooms that we have. We had to take those away last week because they were disappearing. Patients and their families would grab a handful of those, and we ended up with 4 boxes of masks for the entire hospital. So those are now strategically placed so that the providers can get them, and obviously the patients that need them, obviously they can get them too, but they're handed out to them instead of being available for their self-service.
Dr. Grayson, you specialize in pandemics, and I guess the thought process, we are clearly in panic mode right now. When the NBA delays or cancels its season, when The View doesn't have spectators watching what they do on The View, we're scared. Dr. Colby has a lot of tests there. That's a little bit of a help. But let's talk about the death rate. I think 3.4% globally is the death rate. As more people are tested with Colby, hold that up if you don't mind, with that test, we're going to find out that a lot more people are infected with COVID, right? So therefore, the death rate has to come down. Will that calm people's fears?
I don't think so, Eric, unfortunately, because, look, this virus is spreading like wildfire, and we have nothing to stop it. We can try to contain it, but we can't actually stop it. And I think that it's likely that the case fatality rate will come down, but on the other hand, we have a bunch of deaths in China and Iran and other countries that have not been reported. I mean, Iran has been digging trenches the length of football fields. That's not, that's just recently reported by the Washington Post based upon satellite imagery. So it's very difficult in the midst of an ongoing, evolving pandemic to know what the actual case fatality rate is, but we certainly know this. It is much higher than seasonal flu. How much higher remains to be determined. And we also know that many, many, many more people will be infected with this virus than what typically happens with seasonal flu.
Colby, let me talk to you for a second. I don't have a ton of time. I wish I had more time. But you oversee something like 200 plus doctors. What is their feeling? We all know how the general population is feeling. We're scared S-less, so to speak. Are doctors scared too?
So we're not scared. If we follow protocol, if we do what we're supposed to do with respect to infectious disease standards, with how to don a gown and how to doff a gown, how to take it on and off, how to put on gloves, how to put on a proper mask, how to put on eyewear, we're okay. But we can't be going into an infectious disease situation where we're not protected. It's the first time in the history of my 32 years in medicine that I've walked into a room and have not been able to protect myself. That's the scary part.
Dr. Bruce, what about you? Are doctors scared as the population?
I don't think they're scared. Again, it's a situation. Matter of fact, one of my partners is in quarantine right now just because she was not able to get a mask and had an exposure to a patient that tested positive. So all of a sudden, the challenge I think that we have is dealing with the logistics of providing care whenever you may have a number of your colleagues that are quarantined because of exposure.
I got to leave it there, Dr. Grayson. I sincerely apologize. I didn't get back to you. I ran out of time. Dr. Fauci was on earlier, and we had to get questions from him as well. Appreciate your time, Dr. Bruce. Dr. Grayson and Dr. Colby Grossman, thank you guys very much. Coming up next, several members of Congress are now in self-quarantine. I'm talking with Congressman Doug Collins, who's one of them. Stick around. Georgia Congressman Doug Collins is in self-quarantine right now at his home. That's where he joins me now via Skype. Congressman, thank you for joining us. You look pretty good. How do you feel? You have COVID-19?
No, we're actually doing really well. It's good to see you, Eric. We have been here as an abundance of precaution, taking this time to be a part of what really the administration, the CDC have said to do, that if you come in contact with someone who has tested positive, is to stay away. And for 14 days, that's what we're doing. But we show no signs. We're asymptomatic. I've been working here. My wife's honey-do list has been rather long, and I've been doing a lot of phone calls and interviews as well, just so that people will know if they follow the rules, that they can keep this under control.
So is this, and I don't know this, I was at CPAC, is this part of that CPAC patient that came in contact? Is that why you're self-quarantining?
It was. They found that I had a picture with this individual, and it probably was less than a minute total, but just out of an abundance of precaution, that's why we are taking these steps. And again, we want it to be made known that we are asymptomatic. If somebody has come in contact with me over the past 2 weeks, they should be fine. And that's what we just want to make sure people are understanding, that the proper protocols are working. They can keep us safe. Hand washing, if you're sick, go to the doctor, get tested. Do the normal things that you're always told about. If you cough, don't cough on anybody. Those are the kind of things that we can work on together.
So are you being tested? Is that the process during the 14-day quarantine time you're being tested?
No, they told me I did not need to be tested. I talked to the house physician. They said that the best thing for us is, if we wanted to stay away, the best thing is to stay away from folks. And so that we can actually make sure that at the end of this time, everybody can be assured that we were asymptomatic and that nothing was wrong. The thing we need to make sure of, Eric, and this is important, for those that are sick, they need to go get tested. They need to be a part. But for those of us who do not show symptoms, for those of us who are going through our normal everyday life, testing is not important. Testing those that are sick lets us put in perspective who needs to be tested, and also, if they come back positive, how we can take appropriate therapeutic steps in their life. So not everyone needs to be tested right now. We just need to make sure that those who do are not overflowing the system with those who don't.
Congressman, we're going to leave it right there, and thank you very much. We'll check in with you again. I will personally, as a full disclosure, Congressman is a friend of mine as well, so I'll check in on you, sir. Make sure you're doing well, and best to your wife, and by the way, your honey-do list.
Okay, Eric, I appreciate you. Have a great night.
Talk to you soon. Next, in our America This Week special, coronavirus plan, don't panic. Keeping students safe from the virus. The concerns from students who rely on campus housing who are being told to stay home. Welcome back to our America This Week special, Coronavirus Plan, Don't Panic. Johns Hopkins University has created a great tool you can use at home. It's an interactive map tracking the spread of COVID-19. Maxine Stryker with Sinclair station WBFF shows us how you can use this to get the very latest information.
This interactive coronavirus global map is tracking the effects of the virus in real time. It was created right here in Baltimore in our backyard at Johns Hopkins, and it is filled with useful information. This map is tracking the total amount of confirmed cases right here in red. Right now at this time, just before noon, there are 127,863 cases, the most being in China. It will break it down here. You can see the United States with 1,323 confirmed cases of the coronavirus. The site appears to be running a little slow right now, possibly because of the influx of people coming to use this and track the coronavirus. But typically, you would be able to click on each of these countries and it would take you there on the map so you could get a closer look of what's happening. On the right here in white, we have the total amount of deaths. Right now, the number is 4,718, the most deaths, just over 3,000 in China. This green number is representing the total amount of recovered cases, just above 68,000, again, the most recovered in China. Now, Lauren Gardner is the director of the Johns Hopkins Center for Systems Science and Engineering. Her lab created this map that is now being used worldwide. She explains where they get their data.
It starts with the daily reports from WHO and the National Health Commission of the People's Republic of China, but those only come out every 24 hours. So we use those kind of as a baseline, and then throughout the day we supplement with...
Gardner says billions of people are using this map every single day. Things starting to load here on the right now. When you click on the country, it's going a little slowly. It would typically take you there and show you the amount of cases, as you can see here in North America. All the red dots are showing confirmed and active cases. You can see it is constantly being updated here in the left corner as they get new cases in. There is also a mobile version so you can track the coronavirus on your phone. For America This Week in Studio 45, I'm Maxine Stryker.
And schools, colleges, and universities across the nation are shuttering campuses and telling students to stay at home now. Many are extending spring break. Brad Bell with Sinclair Station WJLA talks about the move from the classroom to the cloud with the University of Maryland Public Health.
The campus of the University of Maryland College Park is still a very busy place. Classes are meeting, tests are being taken. Come Saturday, it will become a very quiet place with no on-campus classes until April 10th at the earliest. After spring break and a week to prepare, all instruction is going online. Students admitting it's a little unsettling.
I'm a physics major, and a lot of our classes are very lecture intensive, so questions are very, very useful, so I'm not sure how that's going to work.
I think the worry some students have is housing and board, how will we be comped for that since we're not going to be on campus.
Dr. Boris Lushniak is Dean of the University of Maryland School of Public Health. He is a former acting U.S. Surgeon General. He says the classroom setting does not allow for the kind of social distancing which may be the best tool for fighting the spread of the virus.
This transition at the university setting of going, for example, to online classrooms is the right approach in the midst of all this. Is it going to take away a little bit from the teaching and learning experience? It is, but we'll modify it.
He says the School of Public Health is working now to prepare for online learning and teaching. They already have what amounts to a small TV studio. When they can move back to the classroom here and at the other schools, he says remains unknown.
It's difficult to predict where it's going to go. Is the rest of the semester gone? Unclear, because we're going to be reactive to data, and that data still needs to come in.
In College Park, Maryland, Brad Bell for America This Week.
So what are the practical ways to keep yourself and your family safe? Holly Menino with Sinclair Station Como in Seattle, Washington provides some step-by-step guidance.
Schools are closed and companies are telling their employees to work from home. A COVID-19 outbreak is happening, and we are here to help you plan and not panic. Here's what you should do to keep yourself and your family healthy. At home, clean and disinfect frequently touched surfaces like tables, doorknobs, and light switches. At work, clean and disinfect commonly touched surfaces or shared spaces like your desk, computer keyboard, or phone. The CDC does recommend wearing disposable gloves, but if you don't have a pair of gloves, just wash your hands afterwards. Try to avoid touching commonly used surfaces like an elevator button or door, and no handshakes, elbow bump instead. Whether you're at home or at work, you can take matters into your own hands, including washing those hands. And there's a right way to do it. You want to start with warm water and soap. You want to wash for 20 seconds. You can sing that happy birthday song twice or listen to these additional tips. Limit close contact with others, about 6 feet. Stay away from others who are sick. Stay home if you're sick. Avoid touching your eyes, nose, and mouth. If you don't have soap and water available, use an alcohol-based hand sanitizer that contains at least 60% of alcohol. When you're coughing and sneezing, cover your mouth with a tissue. When you're done, throw that tissue away and wash your hands. Don't have a tissue? Use your elbow instead. The CDC recommends using these preventative actions to keep you and your family healthy. Reporting in Seattle, I'm Holly Menino.
Coronavirus fears have many wondering, is my pet safe? After the break, we speak with veterinarian Dr. Devin Smith to find out. We will be right back with that information. We've discussed the impacts of COVID-19 on the human population, but where do your pets fit into the picture? Joining me now is veterinarian Dr. Devin Smith. Welcome, doctor. Thank you for joining us. You know, I have so many people coming up to me. I'm a dog lover, have dogs. Is there a risk to our pets? Are Rover and Mittens going to end up with COVID? And if they do, what do we do about it?
First of all, thanks for having me. It's good to be here. So at this point, based on all of the research, and it's certainly still unfolding, there's no obvious risk between either transmission of COVID-19 from you or one of your furry friends, from one of them to you, or vice versa. With that being said, as with anybody who has any sort of illness or is immunocompromised, using best practices in terms of personal hygiene is important. So washing your hands whenever or before and after you handle a pet, whether it's a cat or a dog, and any domestic animal. To that point, you know, we are a country that has farm animals and people that work with animals every day that aren't just your dog or cat in the household. And at this point, there's nothing to support that encounters with those animals makes you any more at risk for development of the virus.
Doctor, can our pets, can animals get influenza?
Certainly, they can get influenza, and we do vaccinate for it. And certainly, based on lifestyle, if there are animals that are kept in intensive facilities, boarding facilities, grooming facilities, that sort of thing, it is a vaccination that many of those facilities will require. With that being said, it's not considered a core vaccination, so it's not something that we give our pets routinely. As veterinarians, it's more based on lifestyle and what they might be exposed to.
So I love this topic. I love that we have a veterinarian doctor on the show because of this, doctor. These viruses, these pandemics, these epidemics and pandemics they're coming from animals, right? So we think of Ebola, we think of the avian flu, we think of swine flu, and this one came from what I understand to be a bat in Wuhan, China. Can you tell us how this transfer happens?
Sure. So there's still a lot of research to be done, but based on everything that I've read through the American Veterinary Medical Association, the CDC, and the World Health Organization, like, to your point, many viruses, they believe at this time, based on the similarity in the genome of this virus to other bat viruses, specifically coronaviruses, there's such significant DNA patterns that they do think it's most likely that it came from a bat. And in the type of environment where they think the first case happened, we have to keep in mind that it is in an intensively housed situation where it's a wet market. There's animals, all kinds of animals, not just bats, that are kept in housing, close confinement, often dirty confinement areas that leads to high stress. They're slaughtered in those same environments, and that type of situation simply breeds more disease. That's something that's not new to the human population or our history. Diseases are bred in places with less hygiene, and it's nothing against the culture, but the reality is, with that type of market, that type of situation, we are prone to seeing what we call spillover of a disease from a host, in this case potentially a bat, to a new.
When you say spillover, I want to stop you for a second, Doc. Spillover, and this is where there's a lot of rumor, a lot of people are spreading a lot of maybe misinformation or maybe not. The word was, and what I heard very early on, was that these novel coronavirus was spread via bat to human because there were people ingesting bat meat in China. Is that how it transferred?
Sure. So there's nothing that I've read, and whenever you do your research, please use a reputable source. I have to tell this to my clients all the time.
It was the Google machine.
It was
the internet. So you say that's not reputable?
Yeah. No, it's not reputable. Just keep that in mind. But so spillover happens when an animal that might be a reservoir host, so they have a virus in their respiratory system or whatever the case may be that may or may not affect them in any significant way, is passed to a new or novel host, i.e. a human in this case, through exposure to that animal's meat or their bloodborne pathogens, respiratory pathogens, and when you're in a situation where animals are intensely housed in confined quarters, they're being slaughtered in those same quarters, they're defecating in those quarters, they're urinating in those quarters, and then the human hygiene is potentially not up to what we might consider our standard, the risk is definitely more significant in those types of situations, and that's unfortunately the most reasonable explanation as to how this happened and how we got here. And I think that goes back to the biggest point when you hear anybody talk about this is basic hygiene. Hygiene, washing your hands, face masks. I know that's something that people are, buying off of shelves, but as a medical professional, that's a big concern for us in a hospital situation, particularly in the human hospitals, that supplies that we need in hospitals are going to be gobbled up by people who unknowingly or because they're not well educated think that will protect them, and in many cases it simply won't. It's really going back to basic hygiene.
We're going to say thank you to Dr. Devin Smith. By the way, I got reprimanded by the veterinary doctor, Devin Smith. Stop reading stuff off the internet. That's some really, really good medical advice. Dr. Smith, thank you for joining us and putting to the rest the myth, at least as of this taping, the myth that novel coronavirus can be transferred between pet and owner. At least for now, it hasn't happened.
Yeah, at this point, there's no research for that. Yep.
Thank you very much for your time, doctor.
Thank you.
And we've gone through a ton of information tonight on the virus. Just in case you got a little overloaded, here are some great trusted resources where you can go to find the latest information. Every Sinclair TV station now has a coronavirus section on their websites. Just go to news, then search for the coronavirus tab. Also, the CDC.gov is the main center for all information on COVID-19. You can also get updates on the President's Coronavirus Task Force by going to whitehouse.gov. Thank you so much for watching this special America This Week, Coronavirus, Plan, Don't Panic. And remember, tune in to my regular show. Go to facebook.com/America Bowling, one word, to see when we air in your city. Have a great night, folks. And remember, plan, don't panic.